Welcome to the ECAPS Watch Podcast. I'm your host, Kevin Houlihan, CEO at Workflow Services. Today, I'm excited to be joined by Congressman Scott Peters, U.S. Representative for California's 50th Congressional District, which includes much of San Diego and the surrounding communities. He was first elected to Congress in 2012. Representative Peters sits on the Energy and Commerce Committee and has a strong track record of healthcare access support. He's co-sponsored all three ECAPS bills in the House, going back to the original bill with one of our podcast guests, Congressman Ron Kind, originally introduced back in 2023. Representative Peters, thank you so much for joining me today.
You're welcome. Thanks for having me, Kevin.
So the ECAPS bill is all about increasing access for folks on Medicare to services in the pharmacy, and you're known for being pragmatic and employing a bipartisan approach to increasing access to healthcare. And this bill sure seems to fall into that bucket. Can you tell me about your history with ECAPS and why you're such a strong supporter?
Sure. Well, I sort of think our job in Congress is to provide the basics for people, whether it's an education or a retirement, but certainly healthcare. And we know that pharmacists, you're at the pharmacist all the time, right? In today's pharmacies, they're really easy to get to. They're usually in town. You don't need an appointment. So they become like the first line of defense for protecting against common infectious diseases, flu, RSV, strep, COVID-19. People are used to that. And so, and I think also, it's hard to get a doctor's appointment. It's easy to get to a pharmacy, but not just in areas where we live, where there's lots of healthcare in Madison, Wisconsin. I'm in San Diego, but in rural or underserved communities, pharmacy is a great place to go to get help. And so, providing that you can get these services at your pharmacy makes sense, particularly when there's the scope of practice state authorities that are you have to comply with as well. So I think it's a belt and suspenders way to provide healthcare access and affordability for folks, and it just makes sense to me.
Yeah, that's an interesting thing that we talked to a bunch of guests about this doesn't necessarily change what the pharmacy can do already. It just kind of expands the population of people who can get access to those services. And I had an awesome conversation with one of our guests a few weeks back, and she was talking about how she was doing some vaccinations in a pharmacy, and this gal came in, she was asking what she was up to that weekend. She said, I'm not feeling that great, and she asked a little bit more, and it turned out her patient there probably had a UTI, and she said, you should really head over to see the doctor at urgent care right now. Well, just the fact that she was there at the pharmacy, like you said, like that's the key, right? It's the access point, and that's where people are. And so I think that's such a critical thing, and it's not about displacing something else, it's about adding more access, more areas to get care.
Right. It's so easy. It just makes sense, right?
Yeah. So has there been a narrative or story, or in this is kind of your third round of support for this bill, something that you've heard from someone in the industry or constituent that really sticks with you, that makes you passionate about expanding access in this way?
Well, the healthcare system is changing so quickly, and I think there's a lot of cost pressures on a lot of folks. I know pharmacists are frustrated with a lot of things, and I've talked to them about that. And so in one sense, the scope of practice issues are difficult for them. Reimbursements are difficult for them. The facility or the pharmacy benefit manager process is difficult for them. I think on the other side of it, when we went through COVID, we opened our minds to a lot of things about access we had never really entertained before. We're now completely comfortable with telehealth, which is something I started working on. I represent a lot of veterans in San Diego, and we had a lot of cases where that veteran maybe needed mental health support, didn't want to drive some places, in rural areas a long distance, but even, getting them into the VA in San Diego was tough. They liked the opportunity to engage with healthcare professionals over video, and we could not sell that idea at all until the pandemic hit. And I think, now we have a whole different view of what telehealth is. I think it's similarly true for all kinds of access, and that the rules we thought we had before, that we had to follow before, maybe we can rethink those a little bit. So I again think that going forward, pharmacies can be that first point of contact when you're dealing with your health. And the example you gave is just a conversation you had with someone who knew something, like a neighbor. And I think that's kind of the function of of the the pharmacy. And that person didn't try to solve the UTI on their own. They referred to them to the right level of care.
Yeah.
But without that conversation, that person might have suffered some really difficult consequences.
Yeah, well, that's one of the other big things that we saw during the pandemic, right? Is that the vast majority of vaccines were delivered in the pharmacy, and that was a change. But I think it just proved to everybody that there are certain types of care which are just so well suited to that setting. Is there anything you said in the beginning when you were advocating for more telehealth access, and that was a challenge, but people's perspective changed during the pandemic? I sure hope we don't need another pandemic to increase access to test to treat for Medicare folks. Is there anything that you learned out of that experience that you can take forward and use to try and advocate going forward? Is there a lesson or an approach that you think is beneficial?
Um, I just think we just need to be humble about what we know, what we don't know. The technology is just changing so quickly, and the way we interact in society is changing so quickly. For mental health, there's a lot of changes brought on by social media. We wouldn't even have thought about that 2 decades ago. But the pandemic showed us too the value of being prepared. And again, I could, maybe prioritizing access over kind of control is the lesson for us. The more people, the quicker we got vaccines out. I don't, go back to when the pandemic started, we didn't even have a vaccine. I think that's one lesson for me is, to try to be prepared next time. We did an amazing thing. One thing I give the Trump administration a lot of credit for is Project Warp Speed.
Yeah.
They don't want to talk about it anymore because they're conflicted about vaccines, but that was remarkable to get a vaccine in a year. And then we had to get it out to people. And there was a huge logistical challenge getting it out to people. But once people got the vaccine, the risk of dying from COVID went way down.
Yeah.
And all of a sudden, that affected hospitals, that affected potentially in the future how we dealt with schools. But you can't get that kind of deployment through the typical doctor office appointment, right? I mean, that takes forever. And we learned we didn't need it. So I think that we can be more comfortable now with access through the pharmacy, even if we were before. Now we know that this is a great way to deploy public health. We should take advantage of that. So I think that's a good lesson for all of us.
Yeah, and I think, the interesting thing, similar to what you're saying, is timeline matters on this sort of thing. And so ECAPS opens up the ability to test to treat for some of these respiratory conditions. And there are some of those that you have a window where you can treat, right? And so you mentioned earlier, if you're in a rural community that maybe doesn't have a traditional healthcare facility that's open on nights or weekends, if you can't get in for a few days, you might miss the window to treat. But if the pharmacy's there, and these services are offered there, that's the difference between being able to treat for flu and not at all. And so I just think, that goes back to the logistics of deployment and access and everything that you're talking about.
Yeah.
So this is the
pharmacies
third
are walk-in stores. It's easy.
right.
So like if you go to the hospital, it's very intimidating. It's intimidating for me, and I know my way around, But going through the whole process, getting the bracelet, all that stuff, let's be realistic. I think, we learned that from the pandemic in pharmacies.
Yeah. So this is the third time ECAPS has been around. I am excited because it seems like every single week we get a bunch more support for the bill. And it is shockingly, in this day and age, bipartisan. Lots of great folks on both sides of the aisle are signing on to it. Anything different you see this time around, or anything that's encouraging you? And I guess my number two part of the question is, anything that you as an expert can share on what's the path forward look like, or how does this actually become a reality?
Well, we need to get it on the House floor. I think this one is being led by the Ways and Means. There's two healthcare committees. Ways and Means does a lot of the payment issues. My committee, the Energy and Commerce Committee, does more of the policy issues. So we need to get folks to reach consensus on something that can be brought to the floor. I understand that, Representative Murphy of North Carolina has some some reservations. We think those have been resolved. And so, we want to get more co-sponsors, more attention for the leadership of both parties, that this is something that we need to do. I mean, getting the word out on a podcast, it's a good idea. And I would just ask people who are interested in this issue, who know the issue, are concerned about access, if you let your own representatives know, especially if they haven't signed on to co-sponsor, that they should, I think that would mean a lot. It's just not a hard one to do. This is not one of those difficult policy issues like, say, immigration. The challenge here is more getting people's attention to it so we can get it across the finish line.
Yeah, that's great to hear. For the education of our listeners and viewers, is there a number or a line or a milestone that, if reached in terms of support or co-sponsors, you think really flips it to like, we're on the right track to this has got enough momentum?
Well, the direct answer to your question is 290 can force a vote on the floor. I don't think we have to get that far, though. I think really people are concerned about costs now. Healthcare costs is a big component of costs to our constituents. Here's something that shows promise for lowering costs while we increase access. We just got to get the word out to as many people as we can, and particularly people on the committees of jurisdiction. So, we'll keep checking in with Ways and Means to make sure they get through this, that we get a good product that can be voted on the floor. It is bipartisan, and so I think we got a good shot at getting this thing passed.
Yeah. Any last stories or thoughts you want to leave with the viewers or listeners about this particular legislation or access to healthcare, anything that you're passionate in general?
Well, I'll just reiterate one thing, Kevin, is that the thing we learned from all the elections in the last couple of years, whether it's Trump, Mamdani, Spanberger, Sherrill, they all talked about the cost of living, right? And one big part of the cost of living you're going to hear Democrats talk about is healthcare. Here's a part of an answer. There's, healthcare costs is 1,000 things to do, but one of those things to do is provide opportunities for people to get healthcare that's just as good as they would get from the hospital without going to the hospital. And let's make it easier on people. Let's make it cheaper for people. I think that cost savings angle is really the selling point here. And it's particularly fashionable now after all these elections. So I think we can go get it that way.
Yeah, that is great. I love that sentiment. Well, I really appreciate you joining me. We're recording during holiday week here at the end of the year. So I appreciate you taking the time. I'm curious if you have any special family holiday traditions or movies that you guys like to watch as you close out the year. Any of your favorites there?
Well, we're going to watch It's a Wonderful Life, but my thing is I have a 97-year-old mother-in-law who can't travel, and I have an 8-week-old granddaughter, and we're all going to be together in San Diego. So that'll be a kind of a new tradition for us. We never had a baby before, and we're looking forward to that.
That is awesome. That sounds like an awesome family week. I'm happy for you guys, and it sounds like you're going to have a great time.
Enjoy the snow in Wisconsin.
I will. It's a little bit unseasonably warm right now. We've had a great start to the year. It reminds me back when I was kids. There's snow on the ground. I hope it sticks around, but we like the seasons here, and so I'll take it. My family's a skiing family, and my daughter's a skier, so yeah, we appreciate the winter.
We have seasons in San Diego. It's winter here, so it'll be about 65 degrees and a little bit rainy.
I feel like you're just trying to rub my nose in it right now, but that sounds wonderful. Well, I really appreciate you taking the time. I appreciate the advocacy. I know our listeners and the folks that we work with in the industry do as well. Keep up the good work. We'll keep trying to get the good word out and get people to support it. It's a bill that's totally a no-brainer and can do a lot for the times that we're in right now, I think, for the folks in the country.
Great. Have a wonderful holiday.
Thanks, you too. Thanks for joining me.